Hey, this is Dr. Tom, and I wanted to go over a couple things about whiplash today. Had a couple of people reach out to me the last few weeks about whiplash and what to do about it, and I just put a brief PowerPoint together here for just a few minutes and discussing really what is the best thing that you can do for whiplash. And let's get to the impact problem of whiplash first. So you've got a rear impact, it pushes that car forward, right? So your body, your chest, your body, your legs, everything is connected to that seat will go forward. What doesn't go forward is the neck and the head. And if you look at this second illustration here, that has actually been proven to what happens to the spinal neck, the cervical spine. Instead of just a pivot, it actually transfers backwards. It translates backwards in a shearing motion. So let me get my video out of the way here. So the car seat moves forward with the impact. The head and neck move backwards, and it's not a pivoting motion. And then, of course, depending on your headrest, depending on how far that head and neck will go back. But once the car comes to an end, then there's that whipping forward motion. And this can happen at any angle, any kind of impact to the car, front, side, or back. Most of the injuries are from the back because that's the most common accident style. But that whipping motion, of course, happens when the car comes to an end. And so you've got a lot of damage there. What is actually misunderstood is actually what is damaged and why there's neck pain and headaches afterwards. So what's been proven is that the three tissues that are actually damaged are the facet joints, the vertebral disc, and the spinal ligaments. So not the muscles and not nerves like maybe some people will say or some doctors will tell you. It's actually joints, disc, and ligaments. So let's go very quickly the anatomy here. The joints are right here. The facet joints, you've got 2 per vertebrae, so you've got about 14 of those in your cervical spine. That's where all your motion comes from, the bending, extension, rotation, lateral flexion. You've got the disc, which is more of a shock absorber. That's where we pivot. That's where the pivot of the spine happens. And then you've got ligaments, and this particular graph does not show that, but you've got ligaments that actually come to the very end of the spinous processes here. They cover up some of the vertebrae here. They go inside the spinal canal here, and also on the anterior side here. So what's been proven is those 3 things are being damaged from that particular shearing effect, the hyperextension, and then the hyperflexion. Other tissues that can, of course, be injured are the muscles and the tendons, and very rarely are there fractures involved, but that is definitely important. Now, one of the most important things you can do after an accident is to get medically checked out. I mean, that would be the first thing I would encourage anybody to do, would be to go to the ER, their family physician, and get checked. They can take x-rays, they can do MRIs, they can do ultrasounds, all that type of thing to rule out, right? To rule out the severe injuries that may have occurred or may not have occurred. The next thing would be to find a chiropractor that does manual adjustments, and I'll get to that in a second. And be prepared to have some pain show up over the next few days after the accident. It usually doesn't occur all at one time. It can take a few days. It can actually take a few weeks for things to show up from the accident. One other recommendation, if you need an attorney or you want an attorney, I would say to ask for recommendations from your family and friends, but to get one set up early on in this process is very much needed for paperwork and documentation. So I would encourage you to do that. And one other thing on this page here at the bottom, to things that would help you, start taking a lot of vitamin C. Vitamin C is needed for the body to produce collagen. So we need collagen to repair damaged soft tissue. So extra vitamin C is needed. If you can avoid smoking, smoking will hinder that process of producing collagen. Avoid anti-inflammatories if you can. That's usually the pain medication they prescribe, but I would encourage you to avoid that because it's been proven that the anti-inflammatories actually hinder healing. People stay in hospitals longer when they take that. Situations and conditions remain longer due to taking of the anti-inflammatory. So if you can avoid that, that's great. Now, regarding chiropractic and manual adjustments, as I mentioned earlier, it's been proven that early on, if you can do early mobility, that will improve healing of the joint capsule, the disc, and the ligaments. So early mobilization of that area is crucial for the speed of recovery from the whiplash injuries. Now, a manual adjustment, right? If you've gotten adjusted before manually, you understand a little bit about it. It will unlock that fixated joint or joints. Gives you that little pop that will immediately free up some of the muscles. It immediately improves range of motion, and that's key for these whiplash injuries. Now, all this is in context of if you can stand it and if it's safe to do. Manual adjustments relaxes the surrounding muscles and reduces tension. It actually increases circulation. And by all these three things that we just mentioned, there's pain relief, usually very quickly. Maybe not a lot of pain relief, but there's a noticeable change. Now, early mobilization has been proven to stretch the fibers of that damaged tissue. And this helps the body to align those tissues in a more proper fashion as that collagen is being laid down. Mobility will speed up the healing. Mobility will reduce the inflammation in the tissues. And mobility helps to lessen scar tissue. So that's huge. And we'll get to that in a second, where what you want to avoid is immobilization. So the first thing is, I would not go to and get chiropractic adjustments that use instruments. They're not going to provide that mobilization that you need. The second thing is, avoid neck collars if you do not severely need one. Neck collars are designed to immobilize the neck. It's kind of a crutch. Most people don't need them, but they make people hold their neck and their head and shoulders stiff. That's almost the worst thing you can do. And that's been proven also, because the more immobile you are early on, the more scar tissue will be laid down, and that will prevent healing and cause a lot more problems down the road. And exercising is not the best thing to do right after an injury. You cannot exercise damaged muscle to get better. You can exercise muscle, but damaged muscle needs to heal first, then you can work on strengthening. And any contraindications here for neck mobility and adjustments is going to be things like visual trouble, face numbness, dizziness, extreme swelling in the muscles or the neck or the shoulders, extreme pain. If someone can't touch you, if you have a hard time with anyone touching you, you're not going to be able to have your neck mobilized. Speech trouble or speech problems or swallowing problems, all those are signs of possible neurological problems. You want to have that checked. And again, that goes back to our number one thing: get a medical checkup first. Now, if you have any questions about this, you want me to elaborate on any of this, feel free to contact me through my Facebook group, Dr. Crumbley's Chiropractic Health and Facebook group there. Facebook, use Messenger if you want to do something private, or you can email me at drtcrumbley@gmail.com. I hope this has helped, and I look forward to sharing more information with you soon. Let me stop this, and I'll tell you